How can teachers understand genetic conditions for special education? Imagine a classroom where every child's learning journey is supported by understanding what makes them unique. Teachers play a vital role in helping children with genetic conditions succeed. To do this, they need to understand how genetics can influence learning and behavior. Genetic conditions happen when there are changes or differences in a child's chromosomes or genes. These changes can affect how a child learns, talks, moves, and interacts with others. For example, some children with genetic conditions might have speech delays, attention issues, or social challenges. Recognizing these patterns helps teachers plan better support strategies. The first step is learning about basic genetics and common conditions. Teachers should know that conditions like Down syndrome or 20q11.2 deletion syndrome come from specific changes in chromosomes. Each condition can have its own set of strengths and difficulties. For instance, children with Down syndrome often have learning delays and speech challenges, but they may also have strong social skills. Knowing these basics helps teachers understand why a child might need extra help in certain areas. It is also important to see each child as an individual. Even children with the same genetic condition can be very different from each other. Some might excel in art or music, while others might need more support with reading or social skills. Teachers should avoid assumptions and focus on what each child can do and what they need help with. Using proven teaching methods is key. Many genetic conditions share common learning difficulties. Strategies like sitting children close to the teacher, using visual aids, and providing clear routines help many students. For example, visual schedules show children what to expect during the day, reducing anxiety and confusion. Repeating instructions and using simple language can also make learning easier. Assistive tools like larger fonts or speech-to-text devices can support children with physical or speech challenges. Collaboration is essential. Teachers should work with special education staff, therapists, and families. Sharing information about the child's diagnosis, strengths, and needs ensures everyone is working together. Creating an individualized education program or a 500 for plan helps set clear goals and accommodations for each student. Monitoring social and emotional health is just as important. Children with genetic conditions might feel frustrated or anxious. Teachers should watch for signs of emotional distress and suggest support if needed. Early intervention can make a big difference in helping children develop confidence and social skills. Teachers should also advocate for early support. The sooner a child's learning needs are identified, the better their chances of success. Waiting can lead to missed opportunities for help. Teachers can encourage families to seek evaluations and support services as soon as concerns arise. Supporting life skills is another important part. Teaching children practical skills like dressing, cooking, or using public transport helps them become more independent. This is especially true for children whose genetic conditions affect daily functioning. Finally, teachers must respect physical and medical needs. Some children may have health issues or physical limitations that requiring classroom adjustments. For example, a child with a heart condition might need a modified physical education plan or special emergency procedures. By combining knowledge about genetics with practical teaching methods, educators can create a supportive environment for children with genetic conditions. This approach helps each child reach their full potential and thrive in the classroom.